This is Breast Cancer Group B by Charlotte, Tanisha, Alexandra, Gabby, and Rachel. So what exactly is breast cancer? Obviously, it's a disease that we have all heard of before, but basically it occurs when cells in the breast unrestrictedly divide and form a tumor. Although breast cancer is always serious, what can make it even more dangerous is its ability to metastasize and spread to other areas of the body besides just the breasts. So what happens when breast cancer forms? In the simplest terms, breast cancer affects the proto-oncogenes, which aid in cell division, and tumor suppressor genes, which slow down cell division. When proto-oncogenes are affected, they speed up the process of cell division. When tumor suppressor genes are affected, they are unable to stop the process of cell division. Both of these cause cells to divide uncontrollably. There are many symptoms when someone has breast cancer, and many of these are when the breast experiences texture changes, lymph discharge, color discharge, nipple inversion, bloody discharge, dimpled skin, lumps in the armpit, and lumps in the breasts themselves. Like all types of cancer, breast cancer is not contagious. It can also affect both men and women. There is research to suggest that breast cancer is genetic, or that a person's lifestyle choices that are listed on the next slide can influence their likelihood to have the disease. However, the true causes of breast cancer remain mostly uncertain. Some of the major risk factors I mentioned before are elements such as hormone replacement therapy, late childbearing, such as ages 40 and older, physical inactivity, a family history of cancer, more specifically breast, prostate, and ovarian cancer, menopause after 55, getting older in general, and generally unhealthy habits such as smoking, being overweight, and excessive consumption of alcohol. 12%, or 1 in 8 women, are battling against breast cancer. On average, 1.7 million are affected by breast cancer each year, and America has the best survival rate out of any other country for breast cancer. There are many ways to see how breast cancer has influenced our society. One of the greatest examples of this is Joe Biden's Project Moonshot, a $6.3 billion research bill to help aid the battle against breast cancer, or cancer in general. This project was highly publicized and was a deeply personal bill for a former vice president due to the fact that he had lost his son to cancer only a year ago. Not only is the disease important at a national level, but a personal one as well. I'm sure all of us have known someone who has suffered from breast cancer, whether it be a relative, a friend, or a coworker, so this affects all of us. That also affects all of us financially. For at a national level, cancer treatment reached a total of $87.7 billion in 2014. Unfortunately, the treatment used to fight breast cancer have a major effect on the reproductive system. Chemotherapy and radiation kill healthy cells that produce eggs along with the cancer cells, leaving a person infertile. While there are many forms of breast cancer, some much more invasive than others. One of the most well-known options for the treatment of breast cancer, and many other forms of cancer is chemotherapy. However, there are many other treatment options such as mammoplasty, tissue expansion, lymph node dissection, and mastectomy. While these are all surgical options, there are also a few other non-surgical options, such as radiation therapy and telotherapy. It is important for those with breast cancer to consult with a specialist, such as an oncologist, before undergoing treatment. Here are the sources we used for our presentation, and I hope this video was informative.